Hey everyone, have you ever felt like the world around you is spinning, even when you're standing perfectly still? It's a disorienting, sometimes scary sensation, and it's called vertigo. A lot of people mix it up with just feeling dizzy or lightheaded, but vertigo is very specific. It's the false sensation that you or your surroundings are moving or spinning. So, what's actually happening inside your body when you experience this? Most of the time, the problem lies within your inner ear. Your inner ear is a super complex system that's not just for hearing. It's also the headquarters for your sense of balance. It's called the vestibular system. Tiny canals filled with fluid and hair-like sensors tell your brain which way is up, down, left, and right, and how your head is moving. Now, imagine something disrupts this finely tuned system. One of the most common causes of vertigo is a condition called benign paroxysmal positional vertigo, or BPPV. That's a mouthful, right? Let's just call it BP. In BPPV, tiny calcium carbonate crystals, which are supposed to be in one part of your inner ear, break loose and float into one of the semicircular canals. When you move your head in certain ways, these crystals drift around and send confusing signals to your brain, making you feel like the room is spinning. The episodes are usually brief, lasting less than a minute, and are often triggered by simple movements like rolling over in bed, tilting your head back, or bending over. But BPPV isn't the only culprit. Another common cause is an inner ear infection or inflammation, like labyrinthitis or vestibular neuritis. These conditions are often caused by a virus, like the common cold or flu. The inflammation messes with the nerves that send balance and head position information from the inner ear to the brain. Unlike BPPV, the vertigo from these conditions can last for days and might come with other symptoms like nausea, vomiting, and sometimes hearing loss or ringing in the ears, which we call tinnitus. Then there's Meniere's disease. This is a more chronic condition that involves a buildup of fluid in the inner ear. People with Meniere's disease experience sudden, intense episodes of vertigo that can last for several hours. These attacks are often accompanied by fluctuating hearing loss, a feeling of fullness or pressure in the ear, and tinnitus. The exact cause isn't fully understood, but it's a long-term condition that needs management. It's important to remember that while most vertigo comes from the inner ear, sometimes the problem can be in the brain itself. This is called central vertigo, and is less common but can be more serious. It can be caused by things like migraines, a head injury, a stroke, or other neurological conditions. The vertigo might feel a bit different, often more constant and less intense than the spinning of peripheral vertigo, and you might have other neurological symptoms like double vision, difficulty speaking, or weakness in your limbs. So, if you experience vertigo, what should you do? First of all, don't panic. If it's your first time, it's a good idea to sit or lie down until the spinning stops to prevent a fall. It's crucial to see a doctor to get an accurate diagnosis. They can perform simple tests, often right in the office, to figure out what's causing your vertigo. For example, for BPPV, there are specific head maneuvers, like the Epley maneuver, that a trained professional can perform to move those stray crystals back where they belong, often providing immediate relief. For infections, medications might be prescribed. And for conditions like Meniere's disease, management might involve dietary changes, like a low-salt diet and other medications. There are also exercises, known as vestibular rehabilitation therapy. It can help your brain adapt and compensate for the confusing signals from your inner ear. A physical therapist can guide you through these. Remember, living with vertigo can be challenging, but you don't have to just put up with it. Help is available. If you or someone you know is struggling with vertigo, encourage them to seek professional medical advice. Getting the right diagnosis is the first step toward feeling steady on your feet again. Thanks so much for watching. I hope this helps you understand a little more about what vertigo is and why it happens. If you found this video helpful, please give it a thumbs up and subscribe for more content. Stay safe and take care.